In June of 2003, my wife, Carol, and I, and our daughter, Melanie, lost our son and our daughter's brother, Kevin, to suicide. We learned about mental health in the worst possible way, by losing a loved one. This is an important time. Suicide prevention is always something we need to focus on. It seems like we have a suicide prevention day or week or month, and in fact, every day should be suicide prevention day. We often talk about the numbers and how many people have died by suicide, but rarely do we talk about those that are saved and those that don't die by suicide because of the wonderful work so many of you in this room and so many of you watching this video are doing each and every day. Thank you for the work you're doing, and please keep it up. Our son Kevin was a great young man, studying to be an Army doctor, pre-med student, had so much going for him, but Kevin struggled with depression. He felt shame. He felt like he was not, something was wrong with him, that he had a character flaw. Sure, it was the stigma, but my wife and I didn't understand it. We didn't know enough about it years ago. I have to tell you, everyone gets sad. I get sad, everyone gets sad. I didn't know you could die from being too sad. And our son died because he was sad and we didn't know what to do with it. So please learn about suicide prevention. Please learn about the warning signs so you can get someone some help. Many of you in this room, many of you that are watching this might have lost a loved one to suicide, or a friend or a coworker or someone you care about, and wish you'd have done the right thing. So we all need to do our part to continue to help others to know the warning signs and what to do. When we lost our son Kevin, we knew we had to do something in his memory. We had to do something because of his wonderful life that he'd already had. So we started a program at the University of Kentucky where Kevin went to school called QPR, Question, Persuade, Refer. And staff members there, our family, started getting training in QPR as gatekeepers. And what we found is, as we started learning more and more after Kevin's death, we found out more members of our family struggle with mental illness that we didn't even know on both sides of our family. So the family was keeping it a secret too. Again, I think a lot of that's because of the stigma. Now, have we made progress in stigma? I think we have. But we have work to do still. Work to do. And I'm honored to be at a place that this is what we do, is we help others to learn more, that there's help out there. It's not bad to get help. It's a good thing. It's a sign of strength, not weakness, to come forward and get help. You know, I have to tell you, after we went through this training and our family started talking more about mental illness and what was on both sides of the aisle in the family, we realized something. We talk about health problems, eye problems, other kind of illnesses around the kitchen table and in our family meetings, but we never really talked about mental health. We never talked about mental illness. And we need to start doing that. No matter where you're eating dinner, if it's at the coffee table, if it's at a sofa, if it's in the living room, but we need to talk to people as they're younger even, so they know if you start having these feelings, then please come tell me so we can get you help. Just as if they were having a problem with their stomach or their heart or their lungs. You know, Carol's 7th grade cousin, after we lost Kevin in June, went back to school that fall. And one of the first days of class, she was in class, and one of the boys came into the classroom. And that boy was kind of clowning around, and he came in late, and one of the kids said, "Hey, Jimmy or Billy or Bobby," or whatever his name was, "you know, how come you're late?" And he goes, "Well, I was going to kill myself today, but I decided to maybe wait till tomorrow." So every kid in the class laughed, except Carol's cousin, or Carol's niece. Carol's niece didn't laugh. She had just 2 months, 3 months earlier, lost her cousin, Kevin. So she went to the teacher and asked to be excused, went to the office, called her mom, Carol's sister. Carol's sister then called the office and talked to them and explained what was going on. They contacted the parents, and lo and behold, this young boy had a loaded shotgun in his closet in his home. Now, we don't know if that young guy would have used that weapon to harm himself or someone. We don't know. But just 7th grader hearing and learning about mental health and knowing how serious it is, that it's not a laughing matter, was able to get the word to help potentially prevent this young boy from taking his life. So I'd ask you to do that. Help others. Continue to do the work you're doing. Thank you for the work you're doing and the support you give, whatever position you're in, and the support you give those organizations and agencies, to include University of Behavioral Health Care here, for the work we're able to do to help prevent suicides, to save lives, to keep people going each and every day. Because life sometimes can be a struggle, but you don't have to go through the struggle on your own. There's here people to help you in other places around the country and the state. Thanks for all you're doing, and I ask you to continue to take care of each other.